live in the country. Just look out any window in the house, you're going to see trees. I like it out here, but from my home, it's approximately 98 miles to the White River Hospital. It wasn't that much of an issue before I was told that I need to stay in a wheelchair. But since I've been placed in a wheelchair, my life is made a lot easier getting to the VA with the VA Transportation Service.
My name is Carol Hitchcock, and I am the Mobility Manager for the Veterans Transportation Service here in White River Junction, Vermont. We provide transportation for any veteran, whether they're ambulatory, meaning they can walk, they're in a wheelchair, or they need an ambulance. There are some veterans who have friends and neighbors or just somebody they may know who can get them in here, but they're few and far between. We have a very old population in this part of the country, and we have folks who live out in the middle of nowhere. We provide transportation for those rural vets, and honestly, if we didn't provide that, these folks would not get care.
As far as making the appointment to go down there, it's quite simple. I make a phone call, tell them what time I need to be there, and they come with their van and pick me and my wheelchair up and load me in the van. Off we go to either White River or other places that I have appointments that are relative to my VA coverage.
We see over 10,000 of our veterans, including several thousand high-risk foot patients who are mainly diabetics. Mr. Stetson is like most of our diabetics. He develops chronic wounds that need to be addressed, and he needs to be transported here because he has diabetes with neuropathy. His feet are numb, he can't drive, and he needs to get here in one way or another.
The biggest part of my job that I do is get veterans access to care. And I do that through the best team in the world. We have transportation coordinators. They handle a couple hundred calls a day to set up rides. We also have 5 drivers, 4 of which are stationed around the state to cover all the vets that we need to pick up and get them here on time for their appointments. I love what I do. It really is just a feeling of we make a difference. People come in here all the time and thank the team for doing what they do. We have one gentleman who says, I wouldn't be alive if you folks didn't come and help me out. That makes you feel pretty good.
In the VA, we use technology to reach veterans and talk to them via telehealth or use home telehealth to monitor their conditions, but sometimes you need to see a provider face to face. Our partnership with the Veterans Transportation Program, already at over 80 sites across the country, helps to serve that need, and we need to continue to address the issue of how do we get a veteran to that hospital, to that clinic, so that they can see their provider face to face, because sometimes that's just what it comes down to.